Okay, I think we've got this. Welcome, everyone. Thank you all for attending the Opiate Task Force meeting. We're very glad you're here and you're able to attend. We are seeing an uptick in overdoses. We are seeing an uptick in responses overall, so we're very glad you're here that we can get some input from you and we'll share what's happening out there. Our agenda today will be a report out of all the providers. We'll be starting with Dr. Burstein, and she will report on what the providers are doing. Please make sure you are all on mute. I have the screen here. When you get to your next slide, please just say next slide, presenter, unmute yourself as you present, and I will advance the slides for you. We'll get started now with Dr. Burstein. Thank you.
Thanks. So good morning. Thanks everybody for joining us and welcome back to Monday morning. So this morning we're going to talk, first I'm going to be presenting our Erie County overdose death data, which is Cheryl alluded to, that we're seeing an uptick in cases and a little bit different demographics than we had typically seen in the past. And then I'm going to talk a little bit about what our healthcare provider education and policy reform group has been doing. So next slide, please. So we're first, as I said, we're going to talk about our overdose deaths. So this is a slide looking at our confirmed Erie County overdose deaths, opioid-related overdose deaths from 2012 to so far the number confirmed in 2020. So as you recall, our peak in 2016 was 301. Since then, it's check yourselves if you're muted.
Someone needs to put themselves on mute.
Cheryl, mute everybody and let Gail unmute herself.
I did. Frank?
Yeah, I can't, for whatever reason, I can't get audio. Yeah, both of the speakers are saying when I put it. They have me muted.
I apologize. This is our system. I'm not sure what's happening.
And I put it up too. Make sure that.
Okay, so as I mentioned, we had a high of 301 opioid-related deaths in 2016. Subsequent to that, we've been decreasing every year. So far in 2020, it's been a busy year. We have 44 opioid for this.
Can I jump in here? Somebody has called in and you're also using a computer monitor for audio. You need to mute them both. There you go.
Good.
No, you cannot call in and use your computer monitor. I don't know who's doing that.
Yeah. Maybe you can get it on sound.
I have no control over your phone. I've muted everything else.
Okay. So
welcome to WebEx. Enter your access code or meeting number followed by pound.
This is our system and I apologize. I'm not sure how to stop.
can everybody who's on the phone
I'm going to reshare. Hold on. Everybody hold on. I just muted everybody.
Okay, great. I just unmuted myself. Cheryl, do you want to get back to the slides?
Give me 1 second. I'm getting the slides up. I had to restart everything. I apologize.
It's okay. We'll figure it out.
Yeah. Okay. All right. Do we see them? Are we okay?
Yeah, can you put them on
Yep.
slide?
Yep. Hold on. They're going away. Okay.
So skip to the slide. And put it on slideshow view.
Yeah. Are you able to see them?
Yeah. And there's also. Can you put it just so one slide?
No. Hold on. Let me try again. I'm not sure why it's echoing again. Try this. Is it coming up better?
No, we can make do with that.
Yeah, we're gonna make do. I'm not sure why it's echoing again.
And there's also a big echo. Okay. So, so we've had a very unfortunately busy year this year. So I hope you can see these slides. Okay. So far we have, although we have 44 confirmed opioid-related overdose deaths, we have 127 pending. And actually, these were data from last week. And the updated data that I have shows that we have, sorry, getting that. We have, I think, 48 opioid-related overdose deaths that are confirmed, and we have 134 that are suspected. So, the numbers keep increasing. So what's different? So we know that all 134 will not rule in. However, we don't know how many will rule in, rule out. And in general, the medical examiner said they're seeing a higher number of suspected opioid-related overdose deaths now than they have in the previous couple of years. Next, please. So the next slide is looking at the age demographics of our opioid-related overdose deaths. So from 2015 to 2020, where 2015 is in the aqua blue, 2016 is in green, 2017 is in purple, 2018 is in orange, 2019 is in yellow, and the confirmed 2020 is in green, I guess light green. So just remember the 4, that's a very small number. So these are all preliminary data. So we can't be confirmed on the trends that we're seeing. However, if you notice that from years past, the bars and people in their 20s and 30s were much higher than the other age groups. However, and so far in 2020, even though there are low numbers, it seems like the number of deaths in each age group is very similar. And actually, the number of deaths among the 20-somethings is lower. So if we can go on to the next slide, please. So this is a slide comparing our Erie County population demographics on the left-hand column to our demographics of our overdose death victims in 2018, 2019, and then again in 2020. So remember, the 2020 are very small numbers, so this is all preliminary. However, we're just looking at trends. So you can see that that in 2018 and 19, the demographics of our overdose death victims were similar to the demographics of Erie County. About 80% of the population is white, and about 80% of our overdose death victims are white. About 15% of our community is African American, and about 10% of our overdose victims were categorized as African Americans. However, in 2020 so far, remember these are small numbers, the trend seems to be changing, where we're seeing a smaller proportion of people categorized as white among our overdose victims, and a higher proportion of our overdose death victims are color, either African Americans or Hispanic. Then going down so the gender, trends continue. So we're still continue in 2020 to see a much higher proportion of overdose victims who are male compared to the proportion who are male of our Erie County demographics. And then when you get down to age, again, it's where I alluded to where the demographics trends are shifting. So remember, these are all small numbers, and these are just preliminary trends, so we'll have to see if they stick. But remember, in 2018 and 19, the highest proportion of positive tests were among people in their 20s and 30s. Whereas the trend now is that the proportion of overdose death victims of people who are in their 20s and 30s is shrinking, and we're seeing a larger proportion emerge among people in their 40s, 50s, and 60s. So again, these are small numbers. There's only 44 here, and so we'll have to see if these trends persist. But this is something we have to take note of. And so go on to the next slide, please. So this is looking at the residences of our Erie County overdose death victims in Erie County by locale, either categorized as in the city of Buffalo, or the suburbs, or in the rural area.
It doesn't even register me. It registers you by name.
Can everybody mute themselves?
Which is registered.
Somebody just talked about registering. You know who you are, mute yourself. Thank you. So you can see that the big picture is that we're seeing unfortunately our overdose death victims of every part of Erie County, both in the cities, suburbs, and the rural area. However, there is this 28% of
Carol, I'm sorry, whoever just signed in, please mute yourself. Everyone else is muted, so it's whoever just signed in.
It's Carl Wendy.
Thank you. Mute yourself.
I thought I was.
No. Okay, Gail.
Thanks. So the big picture, 28% of our Erie County population lives in the city of Buffalo, whereas so far this year, over 45% of our overdose death victims live in the city of Buffalo. So there's a disparity there. However, the take-home message is we're seeing overdose death victims from all parts of Erie County. Next slide, please. So here is looking at our the toxicology reports of our opioid-related overdose death victims. And here we're categorizing them as fentanyl without heroin, heroin without fentanyl, fentanyl and heroin, and all other opioids. And just as a reminder, these are all polysubstance tox screen results. So as well as opioids, there's a lot of other drugs found in here. There's a lot of cannabis, hashish, cocaine, amphetamines, benzos. So we're not showing those data. We're just focusing on the opioids and categorizing them by their fentanyl or heroin category. So you can see that the trends we're looking at 2017 data are in blue, 2018 are in red, and 2019 are in green. The numbers are too small for me to really say anything about 2020 yet. However, you can see that most of the overdoses have a positive tox screen for fentanyl. So in 2019, over 70% of our overdose death victims had a positive tox screen for fentanyl, or with or without other opioids. So this is a problem. You know, that fentanyl is killing people. Next slide. What is a trend that's been emerging that we're still continuing to see.
Excuse me, someone is not muted again. Please mute yourself. It's a gentleman. I can hear a man's voice.
So you can see that the trend of a combination of cocaine and fentanyl is being found in almost half of our tox screens right now. So what our scene investigators are oftentimes finding on the scene is a lot of white powder. So what we think what is happening is that, you know, people who don't identify themselves as regular users, people think that, you know, they're you know, older, they may be professional, they may be home alone, working from home, not in the office setting anymore, home alone because they are unemployed now, are they think that they're using cocaine as a recreational drug. They, you know, they don't think they have any type of substance use disorder. They're not engaged with a treatment provider community, are buying cocaine and it's spiked with fentanyl and they're dying. So people don't realize what's happening, that they're at risk of people using cocaine, are also at risk of opioid related overdose deaths. So we're trying really hard to get the word out. So I just want to call out to our you know, our partners out there, if you can help us get the word out. And Cheryl's going to talk about some strategies that we have to try to get the word out. Next slide, please. So it's not all doom and gloom. I do have some good news. So these are Erie County Medicaid data. I've showed you this before, looking at the top 12 prescriptions filled by Medicaid recipients by year in 2014 on the left-hand column, then 2016, 2018, 2019, and then 2020 so far. So the first half of 2020, those data end on June 30th. So you can see, we just want to call your attention to the medication. In red is hydrocodone acetaminophen. So you remember back in 2015 and before then, hydrocodone acetaminophen or Tylenol and codeine was the #1 prescribed medication that was filled by Medicaid recipients in Erie County. And since we formed our task force, that has been dropping. So it moved in 2016 to #3. To 2018, in 2019, it was #10. And I'm proud to say in 2020, it is off the top 12 list. I think it's something like #16. So that is great. So less people are filling prescriptions, or there are less prescriptions that are filled that contain hydrocodone acetaminophen. And something new that we're starting to see is actually buprenorphine made the list of the top 12 prescriptions that were filled by Medicaid recipients. So it's at #12, and we're hoping that it will continue to climb the list, and we'll see more and more people who are able to use buprenorphine, and we know that they're being safe on good, solid medication addiction treatment. And then the bottom chart, I just want to call your attention to, that is corresponding to the number of hydrocodone acetaminophen prescriptions filled by year. So you can see in 2014, about 69,500 hydrocodone acetaminophen prescriptions were filled. And that number has been decreasing with each year. So far, for the first half of 2020, there were about 17,500 acetaminophen hydrocodones prescription filled. So if we multiply that by 2, if we assume that it's going to be the same trend constant throughout the year, then hopefully we'll end to 2020 with only a little over 35,000 hydrocodone acetaminophen prescription filled. So again, that's down from almost 70,000 prescriptions in 2014 to only about half of that. Sorry. Yeah, about 69,000. I can't even see myself. So we're making headway there. So work for everything. Next slide, please. So now I'm going to talk about a couple of task force strategies. So it's I have to admit we've healthcare providers have been distracted or consumed, or I'm not sure the adjective you want to use.
So can I jump in? Just 1 second. Mary Beth Dreyer, I don't mean to call you out, but can you please put yourself on mute? You're the one that keeps popping up here. Can you mute yourself, please? Okay, there you go, Gail.
Thanks. So we haven't done much. However, I hope what we've done has been impactful. So first, we are starting to ask medical providers to place information on their websites and in their offices about the availability of Narcan and substance use disorder treatment. So just information about text for Narcan and never use alone. And we're hoping to be able to get the word out. Next slide, please.
What did we say we were on Sunday?
Rachel Harrison, you're off of mute. Please go on mute. Thank you. Okay.
So if you remember, Dr. Tilda Dosher is running the of UBMD Family Medicine is running our primary care champions project. So we are so this is a group of this is a 5-year HRSA funded grant, and it is recruiting primary care providers to incorporate substance use disorder treatment into one of their into primary care. So right now they have 10 providers from 6 different Buffalo area clinics. Next slide, please. And this is really based on the Vermont hub and spoke model, where the hub is going to be our value network providers that are Best Self, Endeavor, Horizon, and Spectrum. And then the spokes are the primary care offices. So they will interchange. So the hubs will refer out stable patients to the primary care office spokes. And then the spokes will be able to refer patients into the hub, patients who need more help, who they can't manage by themselves, or patients who are newly identified, who they want to get started into stable treatment. So this is a model. It's a bi-directional, and then there's a navigator to help facilitate that transition for patients. Next slide, please. So next steps with the Champions Project. First of all, they found that a huge barrier for primary care providers is that they identify is reimbursement. So primary care providers have believed that the reimbursement from health plans is either not present or not adequate for them to incorporate substance use disorder treatment into primary care. So we're hoping that we could hopefully engage in a conversation with health plans, because I think this can be a cost-effective strategy for keeping people out of emergency departments and keeping people well. Also, the Champions Project want to reach out to physicians who have X waivers, so they are allowed to prescribe buprenorphine. However, they're not using their X waiver to prescribe. So they want to reach out to them, identify what their barriers are, and provide them with support, and actually develop a supportive provider community network that that will consist of office-based providers who are treating people with opioid use disorder. Also, Tilda wants to create a presentation on the road pitch to primary care providers to explain the importance of integrating opioid use disorder treatment or primary care setting. Next slide, please.
Sophia
So
Miller,
I
please
just
put
want to
yourself
call
on-
out to all healthcare providers that Tilda is recruiting a second round of providers to participate in her project that will be starting in October. So it's a 2-year commitment. There is a stipend to help support the additional work. This provides education and support, substance use disorder treatment in addition into primary care. So if you are interested, please contact Tilda Dosher, and this is her email address to get more information. And she is excited to take on providers.
Hold on, Sophia Miller. Sophia Miller, please put yourself on mute. Sophia Miller. Thank you. Sophia Miller. Charles Sims, please put yourself on mute. Thank you.
Okay, so next slide, please. So so that's the end of my formal presentation. I'm not sure if we're going to have questions or comments or save that to the end. Or
Yeah, so if you do have questions or comments for Dr. Burstein or any of the presenters, please put them in the chat, and at the end we will address them all. Thank you. Thank you, Dr. Burstein. And can I please remind everyone, when you sign in here, you are on mute. Please do not unmute yourself because no one can hear and the presenters can't hear. So just make sure you're on mute, okay? Thanks so much. We're going to move on now to Buffalo Matters and Dr. Lynch. Hospitals and emergency departments. I spoke to Dr. Lynch. He did not have any slides, but he did want to give us some updates. So Dr. Lynch, you
Thanks,
can unmute
Cheryl.
yourself, okay?
All right. Thank you very much. And thanks, Dr. Burstein, for all the work that you guys have been doing as well. I'll just keep it very brief. There's really just kind of 2 points. So as I think people have realized over the last few months, emergency departments saw unprecedented drop in visits overall. And we're talking about 50% reduction in emergency department visits for all sorts of complaints. And obviously part of that drop included patients with substance use disorder as well. So we across the Matters Network in Western New York have seen a decrease in referrals, and in response to that have made a very aggressive process to try to get more folks that are working in the emergency departments and in the hospitals in general waivers. So we've trained about 150 providers over the last 3 months going through the X waiver program, and we are hoping that most of them will go on and actually get their waiver. You might remember it's a couple steps. So that is really kind of the major update from the ED. In addition, we have created at ECMC and across the Kaleida Health sites essentially a virtual emergency department, which is primarily available from about noon till the evening time. And those appointments can be set up and done from home at either the ECMC website or the Kaleida website. Most of the providers that are taking those calls have an X waiver or can get access to MAT. They can also help get a referral for patients that don't have any other way to get into the system. So I think a lot of folks have really ramped up telemedicine efforts over the last few months, but the emergency departments have done it as well. And then just the last kind of non-local update is that on or about August 15th, the New York State Department of Health has allowed rapid expansion of what now will be called New York Matters to Utica, Rome, Albany, Rochester, and parts of New York City. So, everyone in this group has been very supportive over the last couple of years, and I think that this is a testament to everyone's hard work that we're able to expand this program and offer it in many other cities across the state. That's all I have, Cheryl. Thank you very much.
Thank you so much. Any questions for Dr. Lynch? Just put them in the chat and we'll get to them at the end. Thank you again. So moving on, next we have our treatment work group, and I know they've been busy. They did a survey and they gave us the results last time. They've been meeting virtually monthly, and I will turn this over to John Grieco and to Julie Gutowski currently. John? I know they're on. Hello? John, are you unable to unmute yourself? Hello?
Hi, Cheryl. It's Julie Gutowski.
Hi,
I'm
Julie.
not sure what's going on with John's phone. If you could just give me a minute,
Sure.
I would appreciate it.
Sure, no problem.
And you can hear me okay?
Loud and clear, and just let me know when you want the slides advanced.
Okay. If we could go to slide 2.
There we go.
Briefly, I just wanted to briefly share that we continue to meet monthly with treatment and prevention providers, family members, peers, anybody who is interested in attending. We would love to have you. The meetings right now are generally via a Zoom meeting or a conference call, and we'll see what happens when we're all more in the community for work. So we have some statistics. I'm on to slide 3.
Okay.
Statistics related to medication-assisted treatment in Erie County. For methadone, you can see that the waitlist information, we've substantially decreased the number of people on a waitlist for methadone, which is great. About as of July 29th, it was 114. And if you look at 2017, we're at 228. So that is really life-changing, I think, for a lot of people.
Mm-hmm.
We have the view slots, and we do have capacity as treatment providers. And we are getting involved with, as treatment providers, sublocade. And if we could go to the next slide, which would be slide 4, about the service link stop.
Yep.
That is a one-stop shop. So it's essentially a hub right behind the holding center. And we have interns there and some staff and a lot of community providers who will be helping people who have criminal justice needs to get the services they need, not just substance use disorders or mental health, but all the different services that they would need. And we have a really great collaboration of community providers who have different specialties willing to come together and work to make sure people get their needs met. It's going to be open Monday through Friday from 9 to 3. And if we could go to slide 5.
You're set.
Okay, great, thank you. I apologize, I'm just on the phone call, so I don't see the slides.
Oh, just tell me next slide and I will click on for you, no problem.
Okay, thank you. So then we do have Ron Schulerman. He's the Director of Intensive Adult Mental Health Services, does a lot of work, a lot of forensic work inside the jails with his team. And he's going to continue as the lead for the county representative. And then we have Eric Weigel, who most people know. Eric's been in the community for a long time. And he's the Director of Dual Recovery and Community Integration. And he's going to manage the day-to-day activities of the service link stop. So that's really exciting. We're looking to have Wi-Fi and an access database that will help anybody who comes in who is interested in services. And we have memorandum of understanding and business associate agreements with the different providers who are going to be providing services in the service link stop, but also accept referrals from the service link stop.
Can folks hear me?
Yeah,
now we can, John.
Hi, John.
Hi there. Sorry about that. I'm not sure what happened. So Julie's doing a great job and seamlessly is right there. So I don't want to stop her, but I did want to let you know that I am on if there's any questions. Thanks, Julie.
Yeah, okay. So we're looking for a soft opening for September 14th. Really looking to finalize our workflows, how people come and get greeted, the services we provide. If you're interested in looking at the service link stop, you may want to reach out and see if you can have a tour or just get some more information. I probably would contact Eric Weigel.
Mm-hmm.
Next slide, please.
Okay.
And this is talking about the Erie County Addiction Hotline. If you remember, we started that in 2016. and it is managed and monitored by Crisis Services. It's answered 24/7. So it's a phone number and anybody in the community can call, and you don't have to have a substance use disorder yourself. You could be concerned about a friend, you could be concerned about a family member, you could just want more information, and the addiction hotline will help you with that. If somebody does call and they are interested in services, the addiction hotline will give you a warm handoff appointment to do an intake at the most appropriate or your preferred substance use disorder clinic. Next slide.
Mm-hmm. Yep.
Okay, we have little sub work groups inside our treatment provider work group, and we have 4 priority committees. For adults, we're looking at to increase access to substance use disorder housing, because that's a huge concern, and to increase access to medication-assisted treatment in the community, really trying to focus on what supports do the primary care practices need in order to provide medication-assisted treatment through their own practice.
Mm-hmm.
And then for youth and adolescents, we're looking for improved access to psychiatric medication and co-occurring treatment. This is a specialty. Even if an adolescent did not have a substance use disorder, not all treatment providers provide care for mental health for adolescents and children. And so if somebody does have a co-occurring disorder, a mental health condition, along with a substance use disorder, the number of providers drop exponentially. So we're looking how can we improve access for those services to the children and adolescents who need those. And we're also looking to improve and enhance family supports and education. So we're excited about that. Next slide. So the family education and support, we're really looking at making information on recovery, behavioral health issues, mental health, substance use disorders co-occurring more readily available to the family and natural support. Really looking at more contemporary ways to get information out to the community instead of just a brochure. So we're looking at, what we could do on YouTube, and looking to partner with a communications work group. And Barbara Burns is gracious enough, she's going to send me the pamphlets that they've designed, and we're going to look to see how we could work those into our information. So next slide, please.
Mm-hmm.
Improve access to psychiatric medication and co-occurring treatment for youth. So essentially right now, this subcommittee is really looking to develop a list of service providers who work with adolescents who have a co-occurring disorder. And not only to have a list, and do you work with individuals, adolescents with a substance use and mental health disorder, but are you accepting new clients at this time? So if anybody is interested, or if you know any additional resources, there is Jody Altman's email address. If you could send her information, that would be great. Next. So this is really about improving access to medication assisted in the community. One of the major issues is engaging the payers, as primary care reimbursement for medication assisted treatment does not make it an appealing service. So we are looking to meet with the Western Region Planning Consortium on the 19th of this month and talk about this barrier to people getting medication-assisted treatment from your primary care doctor. We're going to look at reaching out to physicians who already have waivers and to kind of create a support network. So if primary medical doctor starts somebody on medication-assisted treatment and the person's having a lot of symptoms and needs more support than a primary care office can provide, we want to kind of link them with treatment providers who can do those extra services and make sure the person gets their needs met. And we're looking to create a presentation to take on the road and to really increase utilization and collaboration for medication-assisted treatment. And then the 12 would be increased access to substance use disorder housing. Housing for anyone is a challenge, especially right now with the situation related to COVID-19. So we're looking on developing some type of Google form about current housing opportunities and really look at housing first, meaning a homeless assistance approach that utilizes permanent housing to help people for people who are homeless, and then we can work on the substance use disorder or the mental health or that kind of thing. In the past, what would happen is sometimes for housing, you'd have to get abstinent, free of using any kind of substances, get your mental health stabilized, and then maybe we would be like, well, they're ready for housing now. And studies have shown us that that's not very effective. It is much better to help people with their homelessness. And then when they have a place to stay, then they can look at addressing the other things going on. I'm not going to get into a speech related to Maslow's hierarchy of need. You're welcome, I'm sparing you. Psyches indicators. And so we do look at psyches. This information comes from the New York Office of Mental Health, and it gives us information about people who have Medicaid and, are they getting their medications refilled on time? They have some things called quality indicators that they really look at. And as a treatment provider, if you have an OMH clinic, and I think also perhaps for OASAS providers, you could request access. It can give you lists of individuals who are connected to you for services and say, so Stan he has diabetes and he hasn't had a screening in over 2 years. So you can use the data to more effectively manage people's treatment at your facility and care. Next slide, please. And so this is looking at no engagement in substance use disorder treatment. So this usually means that what has happened is somebody perhaps went to the emergency room because they were having an issue, and it might be substance use related, or it could be substance use not related. However, during that visit, they got tagged or identified or diagnosed that they have a substance use disorder. And this really looks at our people, when they're given a substance use disorder diagnosis, actually getting care. And it'll give you averages for the state, the region, the county, and you can also look for it by provider. Like providers, because I'm at Spectrum, I can look at Spectrum information. Next slide, please. And this again, no follow-up after FUD ER visit 7 days, kind of what I talked about. So the state's at 61% and our county is at 54%. So that's good. We're doing better than the state average. How much longer do I have? Because there's 3 more slides on psyches, but I could kind of bypass them and just talk about the next meeting.
Yeah, I kind of flipped through those slides as you were talking about them. Perfect. So people could see what you were talking about. Yeah.
Great. And so our next meeting for the treatment provider work group is 8/24 from 10:30 to about noon, and it's via WebEx. We would love for you to join us. And the last slide is thank you to everybody for working together to really collaboratively address this vital need in our community. It's tragic, especially given the current situation with COVID, about how many people that we're losing from overdoses. It's truly unfortunate. Thank you.
Thank you so much, Julie. Any questions that you're going to have for the treatment provider group, folks, please put them in the chat and we will address them at the end so that we'll keep moving along. We have a lot of information today. Next up is HIDA. So we have Dan Ronaldo and Crystal Walsh. Here we go. I'll get your slides up, and whenever you're ready, let me know. Dan, Crystal?
Dan, did you want to start? Hi, Sarah.
Hi, Crystal.
I wasn't sure if Dan wanted to start.
Okay. I think
Oh, is Dan on?
yeah, he was.
Well, I can start, and then he can chime in.
Okay.
Okay, let's go to the next slide.
Okay. So who we have here is Crystal Walsh. She is our crime analyst that is with HIDA. And Dan Ronaldo, who is our local HIDA officer.
Cheryl, can you hear me now?
We can hear you both, yes.
All right,
Okay,
Dan's here.
excellent. Thank you. Hi, my name is Dan Ronaldo. I'm a drug intelligence officer for the New York, New Jersey HIDA. On the line with me this morning is Crystal Walsh. She's an analyst assigned to HIDA. What Crystal and I do for the task force is gather all the data that's generated in Erie County about overdoses and overdose deaths by Erie County law enforcement. Crystal gathers this data and she puts it into an easy-to-read report, which is distributed to Erie County law enforcement and the Erie County Health Department on a weekly, monthly, and quarterly basis. And I just want everybody to know that we can gather this data in a relatively easy fashion because of the cooperation we get from Erie County Central Police Services. The commissioner for Erie County Central Police Services is Jim Jansowitz, and his deputy is Marlene Hoffman. Without them being as heavily involved as they are in helping us, this would be a very difficult task for us to do. I want to make you aware that we gather this data and give it back to law enforcement in an easy-to-read form and the Erie County Health Department to support three major initiatives here in Erie County. Initiative number one is the After Overdose Response Program that's done by the Erie County Health Department. The second initiative is the Overdose Death Protocols Program that we established here in Erie County last year. And the third reason why we gathered this data is to support the Opiate Mortality Review Board. We supply them with historical data regarding their cases. So Crystal, if you want to take over and kind of walk us through the slides, it'd be great.
Awesome, thanks. Next slide.
Okay.
All right, so disregard my notes, everyone. Some of them are a little old, but so the mission of the New York, New Jersey HIDA is to reduce drug trafficking and its harmful consequences, but it is important that we are sharing this timely information with public health and law enforcement so that these trends can be evaluated and that outreach and prevention programs can be targeted even better. Next slide. So here's a map of all the crime analysis centers located in New York State. There is 10 total, and they reach about 375 police departments. So there's a lot of information going in, but there's a lot of information going out that we're able to help people. Next slide. And this is a map of the HIDA network, and this is, they cover all of New York State. So this, again, just shows that, we have a great network of people that we're able to use to help everybody out. Next slide. So I gather data, obviously, for these reports, but I just want to talk about OD Map and how important it is. And I use it very frequently, and it covers a multitude of jurisdictions. You can set the parameters to whatever you need, and it really helps to see what's going on. Next slide. So the information I gather is law enforcement data. I get it from our records management systems. And from there, I will analyze that data, create these reports, monthly, quarterly, trend analysis, yearly, whatever anybody needs. And I also create a report that is sent out twice a week that goes out to our partners that our main point of contact, Dan Ronaldo, issues to everybody. Mm-hmm. So in these reports, we've got the Central Police Services, the lab. We've got the reminder from the lab, and that's still important. That's still in the reports. And we also want to put a reminder in about Narcan and how to get it. So that will be a new addition to our report coming soon. Next slide. All right, for Erie County, I know they've already mentioned it. The fatals are 171 year to date, and non-fatals for us, for law enforcement data, is 566.
bringing us to 737 suspected incidents for this year. Our data for 2020, it's much more streamlined, it's much more accurate, and it's much more up to date than it was for 2019. Our numbers for 2019, we had, at this time of the year, we had 64 fatals, 298 non-fatals, for a total of 362. But again, our data for this year is much better. So next slide, and I'll have Dan talk about Monroe County.
Well, we have a drug intelligence officer up in Monroe County that compiles data the same way we do here in Erie County. And the Monroe County data, in 2019, there were 473 overdoses at this time of the year and 71 overdose deaths. In 2020, they're at 461 overdoses and 86 deaths. So their overdoses are down slightly and their deaths are up quite a bit. You want to take it back, Crystal?
Yep. All right. So for Niagara County, I wanted to include them in this as well. So they have a smaller population than Erie County, but they have also seen an uptick in their incidents as well. So for 2019, around this time of the year, they had 14 fatals, 181 non-fatals for a total of 195 suspected incidents. For 2020, my data is there's more incidents, but this is just up until like July 30th, I believe. There was 33 fatal incidents, 249 non-fatal incidents for a total of 282 total suspected incidents for Niagara County. So they are also seeing an increase in suspected incidents. Next slide, please. So this is a protocol for the investigations protocol for police responders. I noticed somebody had the questions there, so I'll go through it really quick. This is important because you want to treat this scene as a homicide. You want to make sure that you're gathering the evidence and documenting Narcan usage, preserving the cell phones if you can. Next slide, please. Seizing laptops, tablets, and just documenting anything you can so they can try to figure out what's going on with the drug transactions, submitting any packaging, canvassing the area, and making sure an autopsy is performed. All right, next slide. All right, so to conclude, we're going to add some stuff to our reports, the Narcan and how to get it. We're still keeping everyone on the same page. Dan's still sending out this information. And, we're happy to assist wherever we can. Dan, did you want to add anything?
No, I think that's it. And I apologize for the doorbell ringing in the background.
No problem. All right, folks. Any questions that you may have for Crystal or Dan, please put them in the chat box and we will address them at the end. Thank you so much.
Thank you.
And here's their contact information. It will all be on the website also. Next group up is our family and consumers. Deb, I know you're on the phone here somewhere. If you'd like to give us an update as to what's going on, if you want to unmute yourself. There she is. Do I hear you, Deb?
Where's Deb?
Do I hear you?
Deb.
Well, she and I talked right before the call, so I can update you while she figures this out. So currently, the Family and Consumer Group has put in an application to the local 5-county OASIS group to apply for some funding to offset part of the cost for a second video from the group. Deb, you there? She did tell me she was able to identify a portion of the funding, so they were looking for part of it. Additionally, the families, and I want to thank them, have agreed to do a webinar. We're going to be doing it in the end of August from the family perspective of living in the world of opioid use disorder and substance use disorder. So I want to thank the families very much. This will be a 90-minute webinar. We will send out the information. It'll be presented by 3 of the moms, 3 distinct journeys that their families went on, and hopefully other families can understand that they're not alone. This is about stigma, and it's about helping people get good data. Additionally, August 31st is Opiate Overdose Awareness Day. It's International Opiate Overdose Awareness Day. We've always had an event down at the waterfront. LaSalle Park is currently being revamped, so we are moving the event. We're looking at Lafayette Square. It will be a full day event. We have a large amount, and it's really sad that we have this many tombstones with people's pictures of their loved ones, stories of their loved ones. They'll be out there all day. It'll be a powerful event for people to come by and see what we've lost in our community. That being said, please reach out to your clients, friends, families. If anyone is not included, if they have lost someone recent, have them reach out to us, send a picture, a little bit about their loved one, and we will make sure that they are included in this event. No one should be forgotten. Deb, have you been able to sign in?
No, Cheryl, this is Deb Cleary. I just wanted to
Deb
add.
Clary. Thank you.
I just wanted to add that Deb welcomes anyone to attend any of the treatment providers if they want to put out a table to give information to family and friends. Everyone's welcome to participate in it as well.
Thank you, Deb. Thank you so much.
You're welcome.
Also, you know, folks, we're just, is that Deb Smith?
It's Deb Smith. I was finally able to
I'm glad
back
you're
off and
on.
redial in.
So did Debbie Cleary and I cover it? We did pretty good, I think.
Unfortunately, when I hung up in order to try and redial back in, I wasn't able to hear anything that was going on. So I missed the family section update. Sorry. But I did go over a little bit of the notes that I have.
Okay.
Even though it may be redundant, and I do apologize, I just want to make sure that we have some type of background information for what it is that we're doing here with the family group.
Okay.
Thank you. The family groups aren't doing any face-to-face meetings, but what we've done is we've done essentially a telephone tree where we check on each other in order to make sure that we're okay through this very difficult time. We have not been able to have our grief groups, and there have been strong requests, many requests for the grief groups to be able to meet. I know that there's a lot of families out there who are really feeling this COVID time, not just as the COVID time, but also as a pressure cooker time for people who are in the midst of a substance use difficulty.
Mm-hmm.
Unfortunately, there just we haven't figured out the bridge yet to completely address the things that are going on in people's homes and being able to make those contacts with each other. There's been an increase in the social media, and a lot of the increase in the social media has been people who have been expressing the difficulty they're having within their own homes and trying to reach their loved ones in order to continue with substance use treatment in light of the difficulty from the COVID. Those meetings aren't taking place, a lot of them, and I think the treatment providers have already expressed that there's been some linkages that aren't quite able to be made in this very difficult time. There's been an increased concern over the number of deaths with the lack of physical resources based on that. But the treatment providers were very good about reaching out to us, and we do want to see if we can do a social media collaboration with them and directly with the families. We're interested in making that information available because the flow of information doesn't seem to be getting into people's homes. I don't know exactly where those barriers are, but they're there. We know that it's not brochures. We know that it's not billboards. So we have to take a look at the best way to reach into people's homes in order to let them know what resources are out there and what it is that the community is doing in order to help families to get the help that they need. One of the continuing complaints seems to be the lack of stabilization place or beds, and people continuing to be turned away from medical care when they seek it due to whatever the criteria is for getting that medical care. We need to figure out a way to get the help to the people who are asking for it, regardless of whatever the criteria is. We need to be able to say, okay, this is the problem that's presenting in front of us, and this is what it is we have to do, instead of saying, well, this checkbox wasn't met or that checkbox wasn't met, because these are people who are showing up. We can't afford to continue to turn them away, not just because it's not life-saving, but also because that message carries so poorly into the community. It doesn't look as if we're prepared to care for that person. And we want to care for that person and that family. If anybody has any ideas about what it is that we can do to get that message across so that the checkbox aren't looked at and the person is looked at, then please let us know what it is we have to do or have to say, especially during those difficult times. We know that there's an increase in the polysubstance use, yet that polysubstance use is not meeting the medical criteria for assistance. So if somebody goes to the hospital and they're having a problem, whether it be with crack cocaine or alcohol, but they don't meet the criteria for getting assistance based on it not being a benzodiazepine, they're turned away. Since that polysubstance use is resulting in death through cocaine, we need to take another look at that very closely. This has to be a case-by-case basis. It has to start to shape into that case-by-case. Cheryl, I'm sure that you talked about the WebEx meeting, and I'm sorry I didn't hear it. I just wanted to state that it combines 3 perspectives, one of them being medical, the other one being mental health related, experimental use, actually it's 4 perspectives, and then a long-term use. So those are the 4 areas that it blankets over. If anyone else can think of any other situation that we need to look at, then please let us know also what that is.
Okay. Thank you, Deb.
Just one second. I have one more. Oh, you already talked about the grant. Okay. You know what? I think that's it for us. Thank you so much, folks, for listening. I appreciate it. You can reach me. I'll give you my personal cell phone number, 716-800-9173. And I'll do what it is that I can to either answer the call or accommodate whatever requests we have. Thank you.
Thank you so much, Deb. Thanks, families, for everything you're doing, and can't wait to see this WebEx and to work on this, because I think this is information that can be helpful to many others. So thanks for your willingness. All right, Barbara Burns. We have the Community Education and Prevention Group. What have you guys been up to?
Good morning, Cheryl. Hi, everybody. So we too have continued to meet pretty regularly. Tried to stay on.
Barb, you're echoing. Do you have both your phone and your computer on?
Let me try this, Cheryl.
Let's pick one.
Well, I don't have my phone on. Can you hear me? Is this better?
Yes, much better.
Much better. Okay. You know what? It was my laptop that needed to be. Okay. So, like I said, we have continued to try to meet on the regular. One of the things that we were really excited about that we were able to get done since we last spoke was we had a conference call, which I may have mentioned the last one. I'm not sure. But anyways, we were able to partner with Meals on Wheels. We had done some messaging with them a couple of years ago, but we wanted to reach out once again to the elderly population. You know, we worry about them normally because they're, you know, might be living alone or not able to get out, and that's on a normal day. And then because of increased concern over loneliness and just less contact with the outside world because of everything that's going on. So we partnered up with, it's actually Feed More Western New York, that the Meals on Wheels portion of Feed More Western New York. And what they did for us is we tweaked our our flyer targeting the elderly population. We tweaked it a little bit with some suggestions from Meals on Wheels, and they sent it out in their, so what they have been doing because of COVID is they have been monthly mailing all of their consumers, just an information packet, hey, we're here, we're still, providing you with your meals. And it's just a way to keep in touch with these folks during these crazy times. So our flyer went out to 4,000 out there. That's their mailing list, 4,000 people in the July mailing. So we were really excited to make that connection, make that partnership, and make that happen. And they, suggested to us that, if there's things we want to continue to do in future months, that we could do that as well. So that's one of the big things that we got done. So one of the other things that we are working on, like everybody else, we're very concerned about the increase in overdoses and the fatalities. So we want people to know that, help is still available. So what we came up with is recording some quick, just little PSAs. So the scripts right now are with Cheryl, and hopefully we can tweak those. We'll get those recorded, and then we'll just start flooding those on, all of our different social media pages. We'll send them out to you guys if you want to put them on your different websites. Just something that I thought of while we're sitting here. I could even send you, once it's finalized, the script. And if you wanted to just have somebody at your organization record it, and you guys can put it up on your websites. It's just a quick, we don't want to overload people with information. We just want them to know, number one, the problem is still very real. Unfortunately, we're seeing increases in overdoses and fatalities, and help is available despite, our world being turned upside down. Help is still available. Narcan is still available. So that's really the message that we want to get out. Now, speaking of social media, Kate Chudoba on our committee, she is our social media whiz kid. She has just done a great job with our Facebook page. And what she has been doing lately is she has these scheduled messages that go out on Mondays. So today, some of the messages have to do with, the language, the addiction language. We've come a long way with that, but we still have a long way to go. We do see, like the media using better terms and shying away from some of the language that, we don't feel is helpful. So she's gotten some messages up about that. And she's also going to be doing some posting from Oasis of, they're starting a, let me check my notes here, an overdose prevention message. So you'll start seeing those pop up on our Facebook page too. So social media, very, very important. And we just had a meeting last Monday or the Monday before, I believe. And one of the things that we talked about that we're going to be working on is this human resource messaging, like really trying to get, again, this whole idea of, during this, we're, seeing, as Dr. Lynch said, less people presenting and more people at home and lonely and finding themselves in more difficult situations. So we want to reach out to people, in their companies, because a lot of their employees are probably still at home. I'm sitting here in my office, which is on Delaware. I'm looking out, and parking lots are still, empty. So a lot of people are still working from home. So we want to use maybe the human resource community as an avenue to get some of these messages out. So that's something that we're going to be working on. I think I pretty much covered everything. So, oh, and I just wanted to address, somebody posted a question about going after the drug dealers, asking if that's something that Erie County can do. I just know that I can speak from the federal level, my office, the U.S. Attorney's Office. That is something that we do with great passion. We have a prosecutor who is dedicated to opiates, and we have charged multiple defendants in our office with it's not a, we don't have a murder statute on the federal side of things, but we have a drug statute that includes causing the death of. And we have charged that several times, and we have gotten convictions. We have a lot of those, we have defendants currently charged. And what we've also started to charge is if somebody overdoses but survives, we can also charge causing serious bodily harm. So we have started to do that as well. So I hope that answers in part the person who posted that question.
And thanks, Barb. I'm glad you shared that. And as far as the overdoses but survived, folks, please understand you are still protected under the Good Samaritan law. People need to actually call for help, and they will get help, and they won't necessarily be charged. This is a funny line that we're running here, so just remember the Good Samaritan law is in New York State that people are protected under.
Absolutely, Cheryl. I mean, we say it all the time. We're not out to get people who are using.
Right.
We understand that they're struggling. So
Right.
thank you for bringing that.
Okay. We just got to keep that fine line there so people will call for help. So thank you all so much. Any questions for Barb, please put in the chat and we'll address them at the end. I'll move on to my work group, the naloxone work group. We have done quite a bit. We've had to change things drastically because of COVID, so I'll go through this quickly. We've made huge changes, actually. So during the time of COVID, which I can tell you when we shut down, it was March 16th here. But since then, starting on April 1st and going through June 30th, I'm just going to give you numbers. We did not stop doing things. The people that were working in substance use disorder, opiate use disorder, continued to reach out to people in the community. The peers continued to reach out to people. They did face-to-face socially distance. If someone needs something, they dropped it off at their house, stood outside, talked to them through a door. I mean, all of these things were not dropped, just so people are aware, because people did what we wanted them to do. They distanced, they stayed home, but they still needed help. We had to look for unique ways to get Narcan out in the community, get messaging out in the community. So we really reached out to our community partners. And we did, actually. We were pretty successful in distributing Narcan in the community, as we normally are. Now, the next part is the connection to care. And that's always in people's minds when they distribute a kit of Narcan. It is getting that hotline number out there. It is getting the number out there for peers that can link somebody and literally hold someone's hand and be there for them. So the following slides here will give you an update on what we've done in responses in the naloxone access work group. We continue to get new numbers in. We do new outreach, and I just want to share with you what we've done. We've had to be creative here, and we changed on the spot. So we're doing outreach events every month here. These are pop-up events. We're doing quite a few of them. We're going out 2, 3, 4, 5, 6 times a week. In Erie County, we have a Live Well Erie vehicle now, which is very visible. We're able to have some privacy for people there. So we're setting up in different areas of the community, geographically dispersed to reach all areas of the community. Crystal, thank you for sharing those maps earlier, and this is why we're reaching all areas of the county. This epidemic has no boundaries. It is opiate overdoses, substance use overdoses in general are everywhere. They're hitting every area of the county, from the farthest south to the farthest north. So that's really the mindset of where we are going. We're distributing Narcan kits. We continue to do it at high rates. We saw a large uptick in April. We started to see the overdoses increase quickly, and that was due to our monitoring with our partners with HIDA and ODMAP. So as you see there, we distributed quite a few Narcan kits in that month. We got them out right away through our law enforcement partners. We had to look at unique partners and who is still out there, who is reaching people in the community. So we did Narcan distribution a little bit different. We did third-party distribution, so that was agencies, that was places like food pantries, that was places like gas stations, it was places like, you name it. If they asked us for kits, we gave them to them so people could access them. Then their biggest partner, as you can see, and this was in April, we partnered with our local law enforcement departments. They have been critical at reaching out to people and getting Narcan in people's hands, and they did a great job. They distributed almost 600 kits for us in the month of April alone. And since then, we've had other departments come on board. When they're at an overdose scene, or they're at a scene that potentially may be one. We have some departments, Cheektowagas, come on board. We're getting supplies out to them. We're getting supplies out to, who else has it? Lackawanna, West Seneca. When they're at a potential scene, they are leaving Narcan there for families with referral information. We've been going to places like food pantries, and I wanted to show you where we've been going. Unique places, where people are gathering naturally. We want people to isolate, but they are still coming out for daily needs. So this is where we're distributing Narcan. It's not just Narcan, and I want to reiterate that. It is peer information. It is treatment information. It is matters information. So what's been going on? Well, Narcan's been used out there, folks, and people are being transported to hospitals. And I want to share this with you. We've looked at this. ECMC is still getting the largest amount of transports. We've reached out to Dr. Lynch, as you've heard, working with Buffalo Matters to really make sure people are connected to care. Buffalo General, connecting to care. These are folks that are all through Matters. Mercy is a high transport site. We know in South Buffalo that we've had a high rate of overdoses, and this is continuous. So we've been working with the Genesis Center, which is a community center. We've been there 3 to 4 times a week. Many people come there for meals, clothing. The hospital itself distributes Narcan in the ED. We have all these different unique areas. We've updated the zip codes of overdoses. As you can see, we have over 2,600 reports. They are very diverse. It is all over the place. It is not in one community. It is not where we think it would be, historically in the 14201, 14202, 14203, Lower West Side, not where we're seeing it. We continue to see an uptick in the suburban and rural areas. We continue to look at the time of day. We now have some 2020 data. Now these are when reversals are taking place, when someone has used Narcan. Looking at the 2020 data, it is around mealtime when we're looking at this. It appears to be around shift work too, very apparent. After second shift, after first shift, and it does kind of make sense when we are interviewing people. And this is why we ask people to use Narcan, folks. Please, please give someone a chance. 93% of people, almost 93%, get another chance. This is somebody's loved one. If they are not breathing, they don't get a chance for treatment. And they're probably not going to attach the first time. But if it's the 10th time, hey, that's okay. If they're successful then, that's good. So what have we done? These are the Narcan emergency boxes. We have distributed about 550 of them so far. We're in process of ordering more. They are distributed everywhere. Just to let you know, every zip code has picked them up. So I wanted to share that with you. Other counties they've requested them. We mail them out to whoever wants them. Like I said, we are looking for more boxes currently, more dollars, and we will be ordering more. Since the onset of COVID, we have also implemented a Text for Narcan program. It's been very successful. This number is out there. Please share it, but share it amongst your clients, share it amongst your friends, family members. Please put it out there in your listservs. We will respond. People will receive Narcan in the mail. They will receive treatment information in the mail, linkage to care information also with it. They receive a package. Very good way to get it out to people so we do not have to be in the same presence. We can keep social distancing and we can get the tool in people's hands. This has been really well accepted. So now we'll jump into where this came from. Actually, was our Response After Overdose program, our Western New York project. Elizabeth, are you on? I'm not sure if she's on. There she is.
I am. Can you hear me?
Yes, we can. So I will turn the slide over to you.
Great. Thank you. You can go to the next slide.
Okay.
So Cheryl gave an update for Erie County. So this is the update for the whole region for our SAMHSA grant, which covers all 8 counties of Western New York. And so we really worked to replicate all of the work that Cheryl's been talking about. So all of the work that's been going on in Erie, we've also tried to do that in the outer counties as well. So we have had virtual Narcan trainings, including workplaces, departments, and community organizations that want to be trained on Narcan have had their own virtual Narcan trainings. We've also had open community virtual Narcan trainings where anyone from the community can sign up, training, get mailed Narcan to them. We've also opened it up to other organizations that are trained as trainers. So if they were trained as trainers through our program and they're going to do a virtual training with their clients, if they just send us the names and the addresses of the people who attended the Narcan out for them. So that's also open.
Mm-hmm.
We've also worked on community Narcan outreach, as Cheryl mentioned. Food distribution sites, we've really worked closely with Niagara County. I know there's a bunch happening in Chautauqua County as well, with which we've partnered with local organizations who are planning on doing that outreach. We've also opened up to community events. So if organizations or community members or leaders have community events and they want Narcan there, we are willing to go there. We've had a couple. We had one recently at a church in Niagara Falls. They had a community event. We showed up with Narcan and it worked out really well. Next slide.
Okay.
So Cheryl mentioned the Text for Narcan program. This has been really successful. So just another pitch, put this on your social media. Feel free to do it more than once. We can tell when people put it up because we start getting texts. Over the last week, the news picked it up and I had over 100 requests for Narcan and over Narcan actually went out just from the news picking it up once. So it really makes a difference for people to see this number. You never know who is going to like it or repost it from your page. So feel free to get this number out there. We really think this is an effective way of getting the Narcan out at this time. This number, I have one over 130. I just sent out over 20 more. So this is over 150 for the last couple of months, which is fantastic.
Mm-hmm.
We also have been working with peers, particularly, with supporting peers within our region. We have the local COPE group, which we started, which is really peers coming together to support each other, to get training and build their skills. So we've had a virtual update with them, and then we also met in a park this past Friday, actually, which was really great to see the peers. Peers are really also having a tough time. Their work is never easy, and at this time, it's a bit harder than normal, even more challenging. We've also been working with peers to educate them about the virtual emergency department visits, as Dr. Lynch mentioned. We know not as many people are going through the Matters program right now, and so we're really trying to educate people that they can get through that system virtually as well. And that is everything. Thank you.
Thank you so much. So as you can see, we've been very busy, particularly the Text for Narcan. I'll put another plug in there. Doesn't matter if you're from Erie County, you're from Steuben County, we will get the Narcan out to you. This is critical. Please share that far and wide. On that note, I am going to move on to the Opiate Mortality Review Board and let you know what's going on there. Kelly?
Hi, can you hear me?
Absolutely.
Okay, so to accommodate for this COVID-19 pandemic, if you could just go to the next slide for me.
Mm-hmm.
We have been doing we've continued our biweekly review boards, but now we've actually gone virtual. So every other Thursday between 3 and 4, we are presenting our cases. We currently just wrapped up case number 9. We are scheduled up until December to meet our 10% goal of the overdoses. We've also started the 2017 cases. We've already interviewed 15 families. Due to COVID, though, we haven't really got much of a response. So I am collaborating with Deb Smith to get letters out and see if the families can use some support from her end and let them know that we're still here and we have services, even if they don't want to participate, and give them some information and hopefully be a link for them and the family group so they can attend some of these, like, opiate awareness, overdose, things like that. We've also updated our brochures for the grief and treatment information that we hand out. And the next slide. So here we do, I do have to update it because things change rapidly. So this is one of the tables that one of the peers have done. They do go out to the antibody sites. It was primarily Mondays and it's primarily Mondays and Thursdays now. They set up tables and they have, as you can tell, Cheryl was telling you, it's not just Narcan. We have a bunch of resources. We have sharps containers, water bottles, a bunch of pamphlets about COVID and things of that nature. And the next slide, please. So here's that van that we were talking about. That's going to be out in the community. That happens to be myself and another peer, Abby. This was our actual first pop-up health fair that we've been doing to go out into the community since they can't come to us. This happened to be actually on Memorial Day. If you guys can see the American Stars and Ensemble, that we were in Bidwell Park. Every Thursday, we're at St. John Canty. We are at food pantries every other Saturday. There's a place in the community, and we do these pop-up health fairs where we, once again, hand out Narcan, training, information, COVID support. If we have masks or sanitizers, we are handing those out as well. And that's basically what we're doing on our end right now to accommodate opiate overdose and the COVID pandemic.
Thank you so much.
Thank you.
Thanks so much, Kelly. And just to put a plug in there, we'll be in Niawanda Park this week, Saturday, from 9 a.m. to 1 p.m. Treatment referrals, Narcan, anything that people need there. So moving on, the Peer and the First Responder Program, the Response After Overdose programming, this has continued during the pandemic, even though people are locked down. Captain Assistant Chief Brian Gould and myself have continued in conversation. This has been really disturbing during the pandemic, particularly in the Cheektowaga area, because we're seeing people we've never seen before. It's really, really disturbing, like people we have never, ever seen before. We've lost people. There's been deaths. They've been alone. They've been at home. And we're continue to monitor ODMAP. As Crystal said, this tool is exponentially important to us now. It is real time. We've had a few glitches with it, other people putting data in, but we have problem solved our way through. But looking at 2018 and then 2019, the numbers went up exponentially. But then we looked at the data of the individuals we've interacted with in the Cheektowaga area, and this is Cheektowaga in particular. And I just want to stress for you folks in law enforcement, the key is for you to refer people to the peers for connection to care. This is updated data. I believe there's 161 clients that are engaged now in Cheektowaga over time. But the key here is, as you can see, over 70% of people who have been referred directly by law enforcement to a peer for support have been engaged in care, and they stay engaged in care when they're followed up with every 30 days. This is critical. This is human nature. We've learned this. That bottom line really hasn't changed. It's about 22 to 23% of people after an overdose, and that's 24 to 72 hours after an overdose, who engage in care. This has been consistent. We have been looking at this data for about 2 years now, so I think we have a pretty good idea of the best way to access people. The client source has changed a little bit. It was about a quarter were direct referrals, and then the rest were after overdoses, and this is during COVID. So I think we really need to get back to interacting with our clients in our communities, do those direct referrals, bring them out to us, let us know where they are. Don't think twice. Don't double think yourself. My law enforcement partners, send an email. We'll get a peer connected with someone. Let that individual know that you're doing that. We'll get them connected. And once again, like Dr. Burstein said, like we've all stressed, everything is cut with fentanyl today. We're not really sure why, how, but it's killing people. This is the messaging. Don't be afraid to share it. Put it out on your social media. It is cocaine. It is methamphetamine. All of these are being cut with fentanyl. So this is really, really disturbing. We have to be very careful here. So on this, I'm going to move on to our healing community study and give you a little bit of update from that. Columbia University has awarded Erie County funding from the healing communities. It is a national study. We are in wave 1. We have all of our staff hired now. Hallelujah. Thank you so much for your support and patience in the community. We've been meeting with our leadership team. Taylor Winter is the local coordinator here. Megan Harris was hired on board at UB to look at data. We're going to be looking at the syndromic surveillance data. We're going to be looking at the ODMAP data, the AMR data, all the different pieces of it to make sure it's not duplicative, that we have a good hold on what's going on there. Some of the things that the leadership group has brought to the attention that need to be addressed here with healing communities. This is only work in the city of Buffalo, but what we need, where are gaps in servicing in the city of Buffalo now per our leadership group. We need additional drug and needle disposal sites. We need an expansion of Buffalo Matters through virtual intake and peer support, working with the Buffalo Police Department, getting some iPads embedded there so people can be linked immediately. And then a continued promotion of the local anti-stigma messaging, the expansion of the Text for Narcan program. So we will be writing these up. Actually, we have, and we will be proposing these to Columbia as the work that needs to continue, and this is what our task force needs to plug in. We also heard the access to care in primary care, Tilda's work, and I'm glad to hear that the treatment provider is working on that. Updated funding in the community. We have applied for a new COSAP grant, which would expand the telehealth model. We should hear about that, and it's a 3-year grant. COSAP is the new terminology for COPE out of the federal government because they're also covering stimulant overdoses. We also applied for a COSAP grant to support the Mortality Review Board to help develop a national database. Additionally, we have a COSAP, as it's called, grant through our probation unit, and I'm going to ask Anita Robillard to give us a little update on that. Can you get in, Anita? Hello?
Hold on. Can you hear me now?
There she is. Okay.
Okay. I didn't know which mute to mute.
I know. So here's Anita. She's going to give us a little update on the probation opioid grant, which also has peers.
Yeah. Hold on. I'm going to mute my phone.
Okay, we can't hear you.
All right, I'm back again.
Okay.
All right. What our opioid unit looks like as of the end of July, we have 28 probationers total in our unit. I happen to be doing some statistics. So we currently have 9 females, 19 males, and the age range is from age 19 or youngest to age 52. On March 17th, the probation department stopped seeing people face-to-face, but since that time, we had 2 cases that were assigned to our unit that we had to kind of figure out how we're going to deal with an initial and get them all set up in our unit, but that were assigned by court. So we got 2 of those. But as we've heard throughout the presentations, people are struggling, which includes people on probation. We've had people that were identified as having non-fatal overdoses, or that officers identified as having struggled with, are really struggling, especially now, with opioid substance abuse disorder. So we did case conferences on those cases, and those cases were either completely transferred to our unit. Specifically, I know we had somebody who had a non-fatal overdose that we identified, and we ended up taking him on as one of our opioid unit people. And then there were others that we decided it would be better just to link them with our peer navigators, so they had that extra support but stayed with their original officers. Let's see here. Our peer navigator, Kathy, currently has 16 probationers from the opioid unit assigned to her and 4 from other caseloads. And we have Julian Campbell, who has 12 of our opioid unit probationers and 10 from other caseloads. It's kind of, while the total number we try to keep even as people come and go, especially if they are on a caseload other than the opioid unit, that kind of, it's whoever has the availability and is best suited to assist that person. So the probation department has also had to adjust. In general, the entire department kind of went virtual and had people do web check-ins. But our department knows, and especially our unit, that our people with substance use disorder are going to have a harder time kind of struggling with all of these things going on. Our peer navigators were able to upload our department's case management system on their home devices, which that way they can see what was going on and kind of update, read notes and put in notes, so we all were on the same page at the same time. Peer navigators also made it a point to reach out via phone calls or texts to each of their assigned, whether it was on their unit or from another caseload. On a weekly basis, they did this. We shared within our department and specifically within our unit a variety of information on virtual recovery support. So when we got that information, we put it out there for everybody to have available. The peer navigators provided their peer counseling and support during this time, and also we had several relapses, so they were the people that were there to kind of help a person with that struggle and try to get them back into treatment if necessary. Let's see. The peer navigators also spoke with probationers, heavily pushing Narcan in terms of, do you need it? You know, what, do you have it? Where do you know where to get it? As a direct result, we've done some what I call a non-contact Narcan delivery, similar to kind of what some of the other slides have shown. We take information, not just the Narcan, but information on treatment. I have the text for Narcan information. We put that all in a bag and we literally drop it off at their door, and then I call them and say, your delivery has been made. So the probation department has been very proactive in trying to get individuals Narcan. I know that I have had many officers now that while we're not seeing people back in our building as of yet, officers are now going out and doing home calls, still doing social distancing, but I have had several probation officers come to me to get Narcan to take to their people. So we're distributing it here at the probation department too. Our peer navigators during the time period for this COVID stuff, they had not been going out and doing home calls or any face-to-face, but that has now changed a little bit. We have our peers are now going out in public spaces, making arrangements to meet with probationers, masks being worn, social guidelines being adhered to, but to kind of get that face-to-face so that that's not being missed. And then we are going to, as a department, be resuming seeing people in our department, which also then increases our opioid unit people, probationers, getting to see our peer navigators on a regular, more consistent basis for that face-to-face. So that's kind of what we're doing here in probation.
Thank you so much for sharing with us. We appreciate it. I'm just going to jump right through here and look at the questions quickly. What's happening here? Let's see here. So we have a question here. How to become a trainer? We are going to be putting up virtual training of trainers, and we will be sending the link out for Narcan trainers. I will send it out. Nicole Kerner, can you mute please? I will send it out to the whole task force meeting. It will be a training of trainers. So not everybody is appropriate for that. So look through your staffing, see who is appropriate as a trainer. They had to have been trained on Narcan originally. It is about a 3-hour training. It will be virtual, and we'll get people certified so they can train within the community. That would be really good. Thank you for asking that one there. We really appreciate that. Let's see what else we got. Access to Medicaid. Medicaid data from Chautauqua County, we would need you to reach out to your Inspector General in Chautauqua County. That was Erie County specific. Hydrocodone prescriptions decreasing, opioids overall. They appear to be decreasing overall and in general. That just happened to be our very high prescribed drug. All right.
That was the number one. We're using it as a proxy for other prescribed opioids because it's the highest.
Thank you. Thank you so much. No, you will not receive a printout of slides. They will be available on the website. You can print them out yourself. They will be up there. They'll be as PDFs. There'll also be a recording of the meeting. It does take a little while for the recording to appear, so it won't be up immediately. It'll be tomorrow, okay? But there will be a recording there too. Question for Dr. Burstein. The second slide had an age distribution. Very concerning so far. The number of deaths in those over 60 has risen to almost the number in prior years. Any ideas how to address that?
Again, we're trying to send messaging out to those individuals. So we're thinking about like where those people go, and I'm almost that age. So like, where do I go? So we're thinking about the grocery store, the gas station, the pharmacy, the convenience store. So we wanted, healthcare provider. So we're reaching out to those entities to ask them to put up information about Narcan and about getting into treatment, and that's a kind of a new strategy that we're going to try. If you have any suggestions, we completely welcome them.
Yes. Thank you. Absolutely. From Kimla Todd, is the service link stop open now?
No, the service link stop is not open as of yet. It's still doing some preparations, as I believe Julie mentioned. We're shooting for a soft opening on September 14th, so stay tuned.
Okay, excellent. Here, my suggestion for the over 60s, to develop PSAs to address the demographic of 60-year-old plus population and develop a letter that goes from the health department out to family medicine and internal medicine providers regarding this as an issue with a screening tool to identify those who might be at greatest risk. Example, history of chronic pain. Yes, doing an expert screening, absolutely. Who is funding the SLS?
The SLS is actually, it's actually a community collaborative in terms of the providers who are volunteering their time to be on site, whether they're community-based CBOs or behavioral health providers. The Sheriff's Office, the county, the Erie County Department of Mental Health provided funding for building rehab. The Community Foundation of Greater Buffalo provided funding for furniture and a mural that is yet to come. Computers were donated by the 8th Judicial District of the courts. So it's really a community collaborative, and Erie County Department of Health is providing some in-kind staffing, and then there's the volunteer community agencies that will help oversee it as well.
Thank you. And I think this was answered, but I'll read it out. I understand the need for community education around fentanyl, as many of these deaths are unintentional. However, what can we do about people who are selling the drugs? And I think Barb addressed that. In other states, these deaths are considered homicides. Was that addressed fully for whoever wanted that? Okay. All right. To what extent does the mix of cocaine with opioids and fentanyl impair naloxone administration and contribute to the increase in fatal OD deaths? That's a good question. We just asked people to treat all scenes as a potential need for Narcan. Don't think because it looks like cocaine that Narcan won't work, and that is what that messaging is about. The same with methamphetamine.
It won't be a problem. I mean, it won't make the, whatever the problem they're suffering from the cocaine worse if they have Narcan on board. So it's not going to hurt.
Right. The name of the National Day in Lafayette Square is International Opiate Overdose Awareness Day. It is an international day. It will be on August 31st. International Opiate Overdose Awareness Day. Cocaine, heroin, and fentanyl ODs. The Narcan will address the opiate depressant, allowing the cocaine effects to influence the patient immediately, including blood pressure spikes, stroke, and muscle breakdown from rhabdomyolysis. That was a comment from someone. So I wanted to share that. Okay. Yes, we will mail to Chautauqua County. We will mail anywhere. Just send a text to us and we will mail it out. Yes, I will send out the graphic for the text for Narcan. Everyone, please share it on your social media any way that you can. Pop-up health fairs, please reach out to me directly and we will try to work with you and get those things arranged. If you know there's an area in the community, we try to do about 3 hours, not a long time, keep it socially distanced, get the supplies out there and then leave. We don't want to cause a huge gathering in the community because that really cannot happen right now. Okay, I think I went through them all. Does anyone have anything else? Thank you all so much. You've been doing great, great work. Any suggestions that you have, as Dr. Burskin said, please send them in. We will take anything that you have. We are trying anything new, trying everything we possibly can. We will get any messaging out there, any suggestions that are different that we may not have done. No idea is a bad idea. Thank you all so much. Have a wonderful weekend or week. It's Monday. Have a great week. I'm thinking it's Friday. Have a good week. Take care.